Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. South Korea confirmed 39 new cases earlier today. 23 of the new cases are from the Seoul metropolitan area. Daejeon City and Chungcheongnam-do Province saw 4 and 3 new cases respectively. In fact, Daejeon continues to see new cases from the cluster infection that originated from a door-to-door sales business. 12 of the new cases were imported, pointing out the sporadic local cluster infections. South Korean Prime Minister Chung Se-kyun said on Friday that the country needs to prepare for a long battle against COVID-19. The briefing has just begun, so let's take a listen.
We also have sign language translation available. First of all, here is Mr. Yoon Tae-hoo with the explanation on the COVID-19 response. Let us now begin our regular briefing for June 26th, Friday. As of today midnight, we have 27 new local infections and 12 new imported cases from overseas. And as of today midnight, the total number of confirmed cases now stands at 12,602. And yesterday, 198 more people have been discharged following full recovery, while another 1,148 people are in quarantine undergoing treatment. The death toll remains unchanged at 282. This morning, KCDC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed our joint efforts with the 17 local governments, and we shared the results of the quarantine measures for the businesses with foreign workers. And we also discussed measures to have a non-face-to-face alternative of the visitors who are visiting the nursing homes. And he said that the rapid surge in the number of global COVID-19 cases, it is soon to exceed the 10 million mark. And he said that the conditions here in South Korea is also very serious as well. And he says in order to have the situation fully under control, he said that we need to also have specific measures of quarantine guidelines for the public. And he stressed that we need to identify the blind spots of quarantine, asking for the public's cooperation going forward. And lately, we have seen a decrease in the number of local infections. However, we still see continued cluster infections or sporadic infections in the metropolitan area, which has also spread to the Chungcheong provinces. And to this, the government is exerting our full efforts to continue to curb the spread of the virus going forward. The central government is closely cooperating with the local governments to look at the blind spots of quarantine, including distribution centers, nursing hospitals, and so forth. Today, we have identified another one of the blind spots of quarantine, which is the business establishments that hires foreign laborers. And as for the dealing with the we have a foreign influx of the imported cases, and we have identified that a majority of the imported cases were identified at the airport quarantine, and we were able to curb the further spread into our community. However, in order to identify any of the blind spots of quarantine that exist within our community, we are carrying out on-site inspection and crackdown. First of all, we have some guidelines for the foreign workers who are clustered, the clustered residents of these workers. And they are also dubbed the Beehive residential area, and it's very crowded with the foreign laborers, and they have a weak abidement to the quarantine measures, including disinfection and so forth. To this end, the Ministry of Justice is cooperating closely with other ministries as well as the communities to carry a joint crackdown and inspection on these residential areas. And it will continue to supply quarantine and disinfection supplies. And the second are some updates on the results of the inspection on the businesses that hire foreign workers. And the Labor Ministry has also continued to carry out a quarantine inspection on about 300 dormitories of the business establishments that hire a number of laborers from foreign countries. And it also put in place administrative orders for about 167 dormitories that had weak abidement to the quarantine measures. And it also looked at some of the 30,000 facilities nationwide, as well as 7,000 dormitories across the country. And as a result, the ministry also identified some 500 facilities in the area of manufacture and about 160 facilities in the area of agriculture and so forth. And the ministry also identified and suggested these facilities to abide by the quarantine measures more strongly. And also the quarantine measures and inspection have also put in place for the residential area as well, including the dormitories, and we checked whether they had the proper checks of the screening of the body temperatures and also the ventilations and so forth. And as a result, we identified that a majority of them, about 1,500 of them, had weak abidement to the quarantine measures. And starting from July, we will be receiving any COVID-19 related reports or suggestions via our public hotline. And this is aimed at reflecting the individual public's idea into our quarantine policies effectively. And the public and the members of the public can also request and report to any of the blind spots of quarantine, and they could do so through a webpage or application. And we also provide incentives, including prize money as well as medals for those best practices going forward. So we ask for your continued cooperation. And the following is some of the opinions on the nursing hospitals and nursing facilities, and we will begin starting from July 1st to implement a non-face-to-face visiting method. Because the nursing hospitals house a number of senior citizens, it is also prone to COVID-19 infection. And also, we have limiting the visiting by the family members. However, many of the senior citizens who are housed there had continued mental dissatisfaction, as they had to be away from their family members for a long time. Therefore, the government also proposed a new method of non-face-to-face visiting method. And to this end, the head of the local governments as well as the community heads can decide on the criteria of such a measure. And all of these visits will be carried out on a booking basis, and all of the people need to have a separate place to have this visiting take place. And all of the visitors to these facilities need to disinfect their hands. They need to wear their face mask and check their temperature, and also have a confirmation of the visitor log as well. And they would also need to sit in between the dividers and separators, and they need to also ventilate the area on a regular basis, and all of the masks and plastic gloves that have been used need to be discarded as soon as possible. And we have some of the exemptions where the senior elderly patients are also at a very critical moment just before his or her death. These circumstances will be exempt from these alternatives. And we believe that the public is deeply concerned about the increasing number of confirmed patients in the Daejeon and Chungcheong area. However, we have an effective management of the live quarantine, live treatment centers there. And currently, we have availability of about 20 hospital beds for critically ill patients, as well as some 180 hospital beds for other patients. So we will be also preparing for a possible surge in the number of confirmed cases in this region. And we will also continue to cooperate with the 4 other cities in the Chungcheong area so that we do not have any rooms of improvement. And during the weekend, we expect that many of the public will carry out gatherings, including religious group gatherings, as well as club meetings. However, we have identified in the recent days that the small group meetings and club meetings were the venues that spread the COVID-19 virus. So we ask you to refrain from going to these meetings, and if you have to have these meetings unavoidably, please comply with the quarantine measures, including wearing a face mask, washing your hands, and keeping a healthy distance. The central government will also continue to consider and come up with ways to keep the health of the public, and we ask for your participation going forward. Thank you very much.
There you have it. We'll bring you more details on the briefing at our upcoming newscast at 12 p.m. Korea time. Goodbye.